Hi everyone, thanks for listening to my presentations. As part of series of presentations on the liver, I'll be talking about hepatitis A. Hepatitis A. Let's go. Hepatitis A virus belongs to the family of Picornaviridae and the genus of Hepatovirus. Formerly known as epidemic jaundice, acute cardiac jaundice, or campaign jaundice. Epidemiology. It occurs worldwide, so hepatitis A could be found anywhere in the world. About 1.4 million cases will be recorded per year. Sporadic or epidemic proportion in certain areas. Incubation period is between 15 and 50 days, or approximately 28 days. It is fecal-oral route in transmission. For example, contaminated food or water. Person-to-person contact also, and is worse in people greater than 50 years old. It could be acquired as superinfection on hepatitis B and hepatitis C. Risk factors. The risk factors associated with hepatitis A virus are the following. A sick person in the family with hepatitis A virus will likely spread it to the rest healthy ones. Sexual transmission is also possible, and it spreads very fast in dormitory, long care facilities, daycare centers, and barracks. Travel is a major source of spread of hepatitis A virus. And that is why when you are about to travel, your physician will counsel you against contaminated water, contaminated food. And of course, through blood transfusion, hepatitis A virus could be acquired. And those that indulge in street or IV drug use, they could also have hepatitis A virus. The pattern. Liver injury when there is hepatitis A virus is dependent on immune response to the virus. The virus divides within the hepatic cells, that is, within the hepatocytes. The ultimate hepatic cells destruction is dependent on HLA-restricted hepatitis A virus-specific CD8+, T lymphocytes, and natural killer cells. The infected hepatic cells are cleared off by interferon gamma promoting clearance. Clinical features. This is a self-limiting condition, meaning that even without much assistance, hepatitis A virus will come and go. 1% will have fulminant hepatic failure. Less than 6 years old will have fewer symptoms. Isn't that a blessing in disguise? Kids who acquire hepatitis A virus and are less than 6 years old will have less trouble. I wish I could be less than 6 years old, but I'm not. There will be sudden onset of nausea and vomiting with fever, malaise, and abdominal pain. The affected person will start noticing changes in color of urine that will appear like Coca-Cola colored. That is bilirubin in the urine, bilirubinuria, and that will start appearing within 1 week. When the individual checks the stool, is likely going to be pale. Then there will be yellowness of the skin, yellowness of the conjunctiva, and everywhere, that is jaundice, within 2 weeks. And of course, there will be itching. The signs are what the nurses and doctors will pick when they carry out physical examination. The sclera will become jaundice, icterous sclera, hepatomegaly on physical examination of the liver, right upper chondrial tenderness, enlarged spleen, that is splenomegaly, rashes and scratch marks from the pruritus, and of course, joint pains, arthralgia. There are other extra hepatic features, which means the problem is within the liver, but the signs and symptoms could manifest in all other organs outside the liver, particularly in long-standing hepatitis A virus. So, we could be dealing with a evanescent rash, arthralgias, optic neuritis. The kidney could suffer and will have glomerulonephritis, transverse myelitis, or thrombocytopenia, on account of which some people will bleed. The heart is not spared because there is likelihood of myocarditis, and of course, aplastic anemia and hypersensitivity that could progress to toxic epidermal necrolysis. Hepatitis A virus could be complicated with cholestatic hepatitis, relapsing hepatitis during 6 months after acute illness. So let me explain. After the individual has come down with hepatitis A virus, okay, within 6 months, there's likelihood of relapsing hepatitis. Autoimmune hepatitis is a rare occurrence, but it is a possibility. And the possibility is that hepatitis A virus can trigger the development of the autoimmune hepatitis. Diagnosis of hepatitis A virus will include thorough history of symptoms, including history of travel, okay, the history of food eaten there, the drink, and blood transfusion, and use of street drugs, IV drugs, sexual transmission, and likelihood, and everything like that. Then we have physical examination, checking for jaundice, and the color of the urine, urinalysis, and everything done. Okay, we'll head to the lab while we are still trying to make the definitive diagnosis. We'll head to lab, we'll find out about liver function test, and of course, liver enzymes. You can check my presentation on functions of the liver function test, and liver enzymes. So briefly, liver function test is all about whether the liver is still good enough to play its role in the life of this person. And of course, liver enzymes will give us clue as to the level of the injury. So for liver function test, we check for PT or INR, APTT, bilirubin, and albumin, and so on. But for liver enzymes, for AST, ALT, GGT, in case of alcohol, that is not specific to the liver, except GGT is 10 times higher than the normal, and ALP that is not also specific, that could point to cholestasis if it is liver related. So we check all those parameters. We'll have serum IgM anti-hepatitis A virus antibodies acid. From acute state to 3 to 6 months after the acute state, we could still pick the serum IgM anti-hepatitis A virus antibodies. The serum IgM anti-hepatitis A virus antibodies could also surface in relapsing hepatitis. If we have IgM and there are no symptoms or signs in this individual, then we are dealing with prior hepatitis A virus infection with either the persistent IgM, or we are dealing with false positive altogether, or this is a case of asymptomatic infection, because asymptomatic infection is very common in children less than 6 years. Remember, I said that earlier, that I wish I could be less than 6 years, but I'm not. IgG will be picked at the convalescent phase, and IgG will remain for decades with lifelong immunity. If we pick IgG in the absence of the IgM, it means past infection, or the individual had vaccination against hepatitis A virus. But this is not an acute infection. Let me explain. IgM is pointing to recent or ongoing infection. IgG is pointing to chronic or past infection. So if we pick IgG without any IgM, it means there is no ongoing infection, no acute infection. It could be past infection in this individual, or it's because he or she has been vaccinated against hepatitis A virus. Okay, radiologically, we can use ultrasound, but there's no need to waste the money of this patient on any other radiological investigation. No. Differential diagnosis of hepatitis A virus could include hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. Hepatitis A and E will form acute infections by fecal-oral route transmission, while hepatitis B and C could be acute or chronic and could be spread by body fluids. Hepatitis D virus is a lazy virus, always looking for the presence of hepatitis B to survive. Don't worry, I have separate presentations on each of these different diseases. Okay, differential diagnosis could also include Epstein-Barr virus, cytomegalovirus, yellow fever virus, herpes simplex virus, adenovirus, HIV or syphilis, malaria in tropical world, leptospirosis, Q fever, alcoholic hepatitis, drug-induced or autoimmune hepatitis, and of course, wheezing disease, that is excessive copper in the face of low ceruloplasmin, and the individual will be on penicillamine for life. In fact, there's a separate presentation on wheezing disease on my channel. You can check that out. Treatment. Since this is a self-limiting condition, even without any intervention, it will come and go. But you can give supportive care, generous fluid, treat symptomatically the pain or fever that may be associated. And in case of fulminant hepatic failure, that is a serious condition. Therefore, referral to specialized center will be required immediately, where the individual could be placed on the list of people that will need liver transplant. Recovery is expected within 3 to 6 months. Prevention, vaccination, okay? And the other big component as per prevention is travel guidance. So when you need to travel, let your physician know, and he or she will guide you as per how you could get hepatitis A virus and other related diseases depending on the zone or the part of the world that you are heading to. But hygiene at home, hygiene when you travel. That is the core of prevention of hepatitis A virus. I will have full presentation on all this in another video entirely, where I'll be dealing with travel-related health counseling scenarios. And with that, I've come to the end of this presentation. Remember to share, remember to subscribe. I appreciate it.